The coronary calcium score explained a quiet look inside your heart's arteries. Your doctor mentions a heart scan, a calcium score, and a small worry starts. Is something wrong with my heart? Or the report comes back with a single number, and you've no idea whether it's good or bad. 200. Is that fine? Should I be frightened? Here is what most people are never told. This score is not a verdict on your heart. It's more like a weather forecast for it. It doesn't diagnose a blockage today. It tells you calmly how much quiet wear has built up in your arteries over the years, so you and your doctor can get ahead of it. So let's walk through it together, gently. So what is a calcium score actually measuring? Something surprisingly simple. Over the years, wherever the smooth lining of an artery has been worn and plaque is formed, the body patches the oldest of it with calcium, the same hard mineral that's in bone. A calcium scan is just a quick photograph of your heart that counts those specks. And here is the key idea. Calcium settles only where plaque has already been. So the scan isn't interested in calcium for its own sake. It uses calcium as a fingerprint to estimate how much plaque has quietly built up inside you. No dye, no needle. You just lie still for a few minutes while it takes the picture. So how does a picture become a single number? Inside the scanner, the CT takes thin slices through your heart, and calcium shows up bright and white, easy to pick out in the artery walls. For every fleck it finds, a computer measures two things: how large the patch is and how dense, how tightly packed the calcium is. It multiplies those, adds up every patch across the heart's arteries, and that total, named after the doctor who designed it. Is your Agatston score one number for the whole heart? And it's almost always read beside a second what's normal for your age and sex, because the same score can mean something quite different at 40 than it does at 70. And this is where a calcium score earns its place. It is one of the strongest predictors we have of a future heart problem, often better than cholesterol or blood pressure alone, because it isn't guessing from risk factors. It's looking at the actual wear already in your arteries. The higher the score, the more plaque and the more reason to act early. But the most useful result of all is a 0. For someone with no symptoms, a true 0 means very little hardened plaque and a genuinely low risk of a heart attack for years to come. Doctors call it the power of 0, one of the most reassuring results in all of heart medicine, with a few honest limits we'll come to. So how is the number read? In broad bands, not sharp lines. A 0 means no hardened plaque was found, the most reassuring result. 1 to 99 is a mild amount, 100 to 399 a moderate amount, and 400 or more means a lot of hardened plaque, a strong signal to take prevention seriously. But please hear this clearly, because it is the most common mistake people make. That number is not the percentage your artery is blocked. It measures how much plaque has built up across your whole heart. It is the size of the warning, not a map of wear. So why does this matter so much for us in South Asia? Because heart trouble tends to arrive early here, often about a decade earlier than in the West, and often in people who look perfectly fit, with a normal weight and normal looking reports. At the very same cholesterol level, a South Asian heart tends to carry more risk. Most of what drives that is changeable, which is the hopeful part. But it does mean the usual risk calculators, built mostly on Western populations, can quietly underestimate us. And that is exactly where a calcium score can help, by looking directly at your own arteries, instead of guessing from an average. Now the part that protects you the most, what a calcium score cannot do. First, it sees only the hardened calcified plaque, the old kind. The young, soft plaque, which can be the more dangerous and the more likely to rupture, casts no calcium and stays invisible. So a 0 is reassuring, but it is not a force field, especially if you are young, if you smoke, or if you have symptoms. Second, a high score is a risk flag, not a blockage. On its own, it does not mean you need a stent or surgery. That's a different decision, with different tests. And third, most important of all, if you are having chest pain right now, this is not your test. Chest pain is an emergency. Call for help. Do not book a calcium scan. So, what is actually involved? Less than you might fear. For this scan, there's no dye and no needle. That's a different test, a FET angiogram, which uses dye to look inside the artery for narrowing. A calcium score is simpler. You lie on a table, small stickers track your heartbeat. You hold your breath for a few seconds, and it's over in minutes. No fasting, no recovery, straight back to your day. It does use a small amount of radiation because it is a CT, but a low dose in the range of a mammogram and far less than most people imagine. For the right person, that tiny cost buys a genuinely useful answer. So who is this scan actually for? It is at its best for one particular person, an adult, very roughly between 40 and 75, with no symptoms, sitting in the uncertain middle. Not clearly low risk, not clearly high, where you and your doctor genuinely cannot decide whether to start a cholesterol tablet, a statin. There, the score breaks the tie. A 0 may let you wait and focus on lifestyle. A higher number tips the balance toward treating. But just as important is who it is not for. Not for someone already at clear high risk, or who has already had a heart attack or a stent. They already need treatment. Not for someone already on a statin, and not as a yearly scan for everyone who feels well. It's a tool for a real question, not a routine. And if you take only one thing from all of this, let it be this. A calcium score is not a sentence, and it is not something to collect out of worry. It is a quiet early conversation with your own arteries. A chance to see trouble coming while there is still so much you can do about it. A high number is not a catastrophe. It is the best possible reason to start protecting yourself today. And a 0 is not a promise you can ignore forever. It's a head start. Frightening on a report perhaps, but understood. It is simply information. And information understood is the opposite of fear. No fear, just the why. So let's lay it on one calm page. First, the number, picture a ladder. 0, no hardened plaque, the most reassuring rung. 1 to 99, a mild amount. 100 to 399, moderate. 400 and above, a lot. Act in earnest, and always read it beside what's normal for your age and sex. Then the one question that protects you in 3 parts. 1. Am I the right person for this? No symptoms? And a statin decision that's genuinely undecided. 2. Will the result actually change what we do next? And 3. If I'm already on treatment or already at high risk, do I even need it when the answer won't change the plan? So what does the number actually change? Less drama than you'd think, and more action. A higher score usually means treating your risk more firmly. A statin, tighter blood pressure, the everyday habits that genuinely move the needle. It rarely means rushing toward a procedure. And here is a twist that surprises almost everyone. Once you are on a statin, your calcium score can actually go up. Not because things are getting worse, but because the treatment is turning soft, risky plaque into hard, stable, calcified plaque. Denser calcium can be safer calcium, though the score itself was never the target. Which is exactly why we don't repeat this scan to check whether a statin is working. The number that matters then is your cholesterol, not your calcium. A few last honest words about the test itself. A 0 today is not a 0 forever. Calcium can appear over the years, so it's reassurance with a quiet shelf life, not a lifetime guarantee. The scan can also pick up things outside the heart. A small spot on a lung, most often harmless, which can lead to another scan, just to be sure. And it can never replace listening to your own body. None of this is a reason to fear the scan. Only a reason to read it for exactly what it is. And once more, because it matters most of all. If something feels wrong in your chest right now, this is not the test. That is an emergency. See a doctor without delay. So, the whole thing in one breath. A calcium score is a quick, no-dye scan that counts the hardened plaque in your heart's arteries and turns it into one number. A powerful read on your future risk. A 0 is reassuring, a high number is a reason to act, not to panic, and it is never a measure of a blockage. It's for the person in the uncertain middle, deciding about a statin. Not for everyone, and never for chest pain happening now. And it has nothing to do with the calcium blood test or the calcium in your bones. If you'd like all of that on one clean page, the score bands, what they mean, and the questions to ask, just comment the word honest and I'll send you the free one page. Calcium score decoder. If this made the idea of a heart scan feel a good deal less frightening, do consider subscribing, because that is the whole point of this channel. Your blood, your heart, your scans, no single test is ever the whole story, and we are making sense of them one at a time. We take the things that frighten you in a medical report and we make them make sense. Sushruti. Sushruti. Worth knowing. One last thing, and it matters. This video is general information, not medical advice, and it is not a substitute for your own doctor. Whether you need a calcium score and what your result means for you is a decision for a qualified professional who knows your history. So if something is affecting how you feel, and above all, if it is an emergency like chest pain, please don't wait. See a doctor or call your local emergency number.